Hi guys, welcome to our channel. Introduction to OT.
History of OT. On March 15, 1917, the National Society for the Promotion of Occupational Therapy was founded by William Rush Dunton Jr., or well known as Father of OT. Eleanor Clark Slagle is called the mother of OT because of her foundational role in shaping of OT as a professional, not just an idea. In 1917, she was a founding member of the organization that became the American Occupational Therapy Association. On 1958, Mrs. Babarati started to establish OT in Malaysia. Then Mrs. Aisyah Hakim joined the team and became first Malaysian OT in 1960. The first formal occupational therapy department was established at Hospital Kuala Lumpur in 1972.
Today I'm with one of the student occupational therapy, Aisyah Zahra. Okay, I would like to ask one question. So what does really OT do for their work?
Occupational therapy, they help people perform daily activities that can help improve their quality of life and independence. The activities are such as self-care, study, work, and leisure.
Okay, so for the next question, we have Tasha with me. I would like to ask, where does really OT works at?
Okay, actually, there's a lot of place that OT work. Personally, in government and private sector, for instance, hospital, rehabilitation center, clinic, and more.
Okay, so you have mentioned private sector, right?
Yes.
Can you give me example for the private sector name or what does really they do?
I think Kiwanis Down Syndrome Center is one of the example.
So for the next question, we have Balkis Isma with me. I would like to ask, what is a good characteristic to be a good occupational therapy?
To be a good occupational therapist, we need to have empathy because we work with people physical and mentally, so we need a very good empathy to know them more. Also, we need to have a good communication skills. Without communication skills, we cannot talk with passion. So with that, we can talk slowly and we can understand what passion needs, what passion wants. A key quality is passion because we work with so many types of passion.
The next question, I have Ayuni with me. I would like to ask, what is the scope of OT?
Basically, scope of OT focus on helping individuals of all ages to improve their daily life. And basically, it can be baby, it can be adult, teenagers, and even elderly who comes to see an OT to improve their daily living by doing activities like eating, bathing, and others.
So Ayuni, the viewer asks, does OT really important? Like, they compare the occupational therapy course with physiotherapy. How about your thought?
Many people thinks physiotherapy is better than occupational therapy, but physiotherapy only cover the physical parts. If people get injured or something else, but occupational therapy it help people to live their normal routine or life.
So, what is OTPF? OTPF is a guide that helps occupational therapy with the scope of OT practice and how to support patients' participation in daily activities. OTPF describes as domains and process. Domains is the outline that areas of concern that occupational therapists address to support participation in daily life, such as cooking and cleaning, while process explains the steps occupational therapy follow to provide effective intervention for the patient. These are the three main aims of occupational therapy. First, to promote independence in daily activities. Second, to enhance quality of life and well-being. And lastly, to restore, maintain and develop skills needed in daily living activities. Nowadays, people are increasingly recognizing the importance of occupational therapy, partly due to social media content such as TikTok and Instagram that raising awareness about health, rehabilitation, and autism kids that need an extra care and help from occupational therapists. Occupational therapy is a client-centered healthcare profession that helps individuals achieve independence, improve daily functioning, and enhance quality of life. By addressing physical, cognitive, emotional, and social challenges, OT empowers people of all ages to participate fully in meaningful activities, promoting overall health and well-being.